My name is Chandon Williams, and I'm with Isthmus Wellness. And today I have our sports medicine specialist, Liz Mierendorf, with us.
Hi.
She is a sports trainer turned acupuncturist. So today we'll be having a chat. Yeah, so why don't you start? How did you become an acupuncturist? Like, what led you to needles?
What led me to needles? Great question. I started out in sports medicine, basically because of my own sports injuries, and things led me to be passionate about helping other people with injuries and just fascinated with the body. And when I was in a fellowship after undergrad, I was observing lots of people in Western medicine, especially orthopedic surgery and pretty much everything under the sun. In athletic training, you have to know a little bit about a lot of different things to be able to help athletes the best way. And the ones that stuck with me were the people that really didn't get better with traditional treatment or rehab. And a lot of people, it just kept coming up on my radar that people would get better with acupuncture. And I had some personal experience with it. And I really thought you had to go to China to learn it back in the day. There was no, not a lot out there about becoming an acupuncturist, or even like anyone that was not from China that I had met that did acupuncture. So I met the acupuncturist for the Patriots and the Bruins. He was a guy who had been an athletic trainer before, and I decided to just pick his brain. It was so fascinating how it worked, and people just turned corners, and it seemed so mysterious. I thought it was just placebo, but there's a thing about placebo where it's like, who cares if you're in pain, if it makes you better, then it makes you better. So I just decided to, passionate curiosity is the short answer to that. And I thought I could have a unique approach to it with having a background in a lot of musculoskeletal injuries and things like that. And that's kind of what came true.
What is your approach? What does make working with you unique?
I take my backgrounds of people, my intakes, when someone comes in and I interview them about their injury or their pain, I do a really thorough history, and it's the exact same history that I did before. So it's similar to what you would get when you go into a doctor's office, like a sports medicine doctor. The person that first meets you is the athletic trainer. That's who I used to be and who I used to learn from. So I'm asking familiar questions. I think that's cool. What makes your pain better and worse? Of course, most acupuncturists do that. But I also want to get, what would I say it is in Western medicine and what would I say it is in TCM? So I kind of combine those two things. And sometimes people haven't had even that thorough evaluation where they're like, I think you have, a rotator cuff tear, or I don't think this is actually a nerve problem. I know that's intense pain, but I think it's just, impingement or something. So that's kind of nice and comforting for people, I think. And I'll explain their injury in ways they can understand, but then also how we're going to approach it from our standpoint, which sometimes sounds familiar. And then there's other things that may not sound as familiar.
What you said about speaking to people in terms they understand,
mm-hmm.
Can you say more about that? Because I feel like there's this whole thing going around right now, like acupuncturists work with energy only.
Mm-hmm.
It's yeah, but we also take a Western board. So can you explain a little bit more about that?
Yeah. So I think some people want to know about chi, which is our word for energy, right? Mm-hmm. It also has lots of different translations in different languages, right? Where we've heard about it from yoga or something like prana. There's a concept where it's this is just the force behind everything, right? In the body. But people don't necessarily understand that, and it sounds foreign. It sounds like you're gonna, it's scary to come into this world where it's what are they gonna do to me? Are they gonna look into my eyes and be like, something's all off with you? And I think some of us have had that experience where it's kind of a little vulnerable and a little bit just feels uncomfortable. And I think translating that into words that they've heard maybe from other medical providers, it makes them feel more comfortable. And so I'm not going to necessarily just talk about your chi right away unless you ask me to. I feel like I want to talk about your actual anatomy, what I think is going on with your injury, why you might have developed it, which is going to sound very familiar to what a PT or chiropractor or doctor has told you already, or maybe something that you looked up on your own and because you're avoiding that or you're not able to get in with a specialist for a while. So I think it's just really nice for people to know, I'm going to talk about that instead of, and use familiar words like your sciatic pain instead of you have chi and blood stagnation in your bladder channel, you know? So I think that helps. And then I can say, well, this is what we call it over here, and this is what this is. And I think people have a hard stop when you start talking about it in a different way, where they're like, I don't know if that person knows what they're talking about, you know? And so I'll try to make that transition as smooth as possible for people, where I'm like, it's really not all that different. We're just using different words to describe the same thing. Like if I mention the liver channel, I'm like, it's not your actual liver. Don't worry. It's your Chinese liver. So I don't know if that makes sense.
Makes sense. Okay, so my next question is working with pain and acupuncture working with pain. Like, are you just needling the spot alone? Like, can you talk more about the system that you work in as an acupuncturist coming from that Western background?
Yeah, that's a great question too. I'm going to talk about two different things, I think, here, which is sort of the standard treatment, which, I mean, there's something called like the 80-20 rule. Like if it looks like a duck and it walks like a duck, it's probably a duck. And I'm going to treat it like a duck until it tells me it's not that thing. And that about 80% of my patients will come in with an injury that I'm like, this is how I'm going to approach it. This is what works 80% of the time. And that means I'm going to needle the area directly and do some other things kind of throughout the whole body. People will come in, let's just call it a shoulder injury. And they're like, why are you doing points on my legs? And it's like supportive, right, for the whole body. Because if your immune system isn't functioning properly, no matter what I do to your shoulder, it's not going to stick. You might get a few days of relief, you know, if I go in and needle some trigger points or release some tight muscles or get some blood flow going to the actual tissue, which people don't generally understand that concept. And that works a lot of times to give people some relief. However, usually when somebody is coming into us, it's because they're not getting better as fast as they want to, as fast as they expect to, or they just want to get better faster. And that's like all medicine is creating an environment where your body can heal itself. And so we're creating an ideal environment for that. But I'll talk about it in very simplistic terms, where acupuncture is an immune system stimulant. So it'll just help your immune system do what it's meant to do. And sometimes people just think immune system means coughs and colds, but it also means your ability to fight inflammation. So people generally understand also that inflammation can run rampant. Like, why is this, you know, chronic? Why has it become this way? Why has it not gone away? Like when I was a kid and I'd sprain my ankle and it would get better in a week or whatever. And now I still have this pain years later or whatever, weeks and weeks of trying to recover. So I'll just explain, we need to get your immune system to start recognizing this like an inflammatory response and do what it's meant to do. So that's where the acupuncture kind of comes in addition to the local needling. So then that's the 80% of people where I'll do, it's like mostly local stuff, but I also do supportive things to help the body get better. And they'll notice things like I feel more relaxed, also like calming the nervous system so it can get into a state of healing. So it's the nervous system and the immune system I feel like I talk about the most. Because if you're in a state of fight or flight, you're also not going to heal very well.
And can you give an example of the state of fight or flight?
Sure. Yeah. So like chronic stress, right? Like I think we're all under a little bit of stress all the time. That's how we function a little. And if you have been in an elevated state, so whether that's just, let's just call it parenting small children. Like, I don't know how anyone can do that without being in a little bit of a state of stress or sort of heightened awareness and not necessarily focusing inward a lot. So if you're in that state, your brain isn't going to recognize, you know, a chronic pain or like a level of pain that's sort of below a 10 as something that it needs to focus on. So we need to get it. It can only heal really when it feels safe and when you're in a state of rest and digest or your parasympathetic nervous system. So that's one of the automatic effects of getting acupuncture, is that we get you into that state more easily. And a lot of people have trouble accessing that when they're in that elevated state of stress.
And does the effect of, because sometimes I get acupuncture and I'm not relaxed, like, is it still doing what it needs to do?
That's a really good question. Yes. So that's been shown that you don't need to feel relaxed during the treatment necessarily to have the effects take place later. Sometimes some of my most effective treatments, just personally, I think I was on the table for like 15 minutes and I got really restless and I got up, but like I felt immediate change and it lasted for days. And that was one of my experiences that actually got me to become an acupuncturist, because I was like, there's really more to this than I originally thought.
What changed for you for days that would make you want to do this as a profession?
At that point, I was having some kind of immune system response they couldn't really figure out. And prior to that, I had pain. Pain is hard to measure, right? So it's subjective. We say, what's your pain on a scale of 1 to 10? And like, it's an annoying question because intensity of pain is very different than how bothersome something is. But I digress. So I had less pain, but this time I had like some immune response going on that no one could really understand. But they're like, here's antibiotics. And I was like, what the heck? I just mentioned it to my provider who I was there to get my pain treated. And it completely went away. Like my lymph nodes were swollen and they were no longer swollen. That was the craziest experience of my life, where I was like, what voodoo? And he's like, it just helped your immune system with whatever was going on. And I was like, huh, okay. But like, I never looked back. And now I approach it differently where I'm like, I'm going to go to an acupuncturist first for things before I go, unless it's something that they can't address or it's something more extreme. Then that's where Western medicine comes in, or going to a typical provider. So
what do you feel like is missing in medicine, the way we treat pain?
That's a great question too. I often have this conversation with my patients where let's just say they went to the ER, urgent care, with some kind of acute pain. And they're like, they don't really do much for me. And I'm like, their job is really to figure out that you're not. And you don't need surgery. You don't need, intervention right away. They're going to probably do an x-ray. Hopefully they'd at least do an x-ray, tell you that it doesn't look like anything. And then they're going to refer you on. And then you might get into somebody who's going to give you a little bit more in-depth reading about what's causing your pain. There's this gap, right? Where it's like, okay, hey, you're not dying and you're not in need of surgery, but you're also not well, right? Like you're not sick, but you're not well. Their job is to make sure that you don't need immediate intervention. There's not more going on. You should never ignore pain just because you think that they might blow you off or something like that, right? So take it seriously, but also their job is to, make sure people don't die. And so keep that in mind. And then there's this gap where it's like, but I still don't feel quite right. And pain is always there for a reason. I think that it's not that providers don't know how to help pain. I think there's a system that is disjointed, right? So there might be months before you can get into a specialist. Then you have to take a few months to get into the right physical therapist. That physical therapist might not have the right approach for that person's body. Again, 80-20 rule. It's like this person might not get better with that approach, even though maybe 80% of people do. I think we come in because we want to provide people with relief and a little bit of insight and feeling like more at peace with what's happening in their body, because it's scary to not know. And they might not be getting those answers in a quick appointment or in someone will contact you and you'll get it in 3 or 4 months or something. I think that's a big deal in our system. And that's where I think a lot of people find value in our work, is by having us as resources in that way, and then also getting relief on top of it.
And how does like an acupuncture needle affect a muscle or affect pain? Like what is it doing?
I love that question because I asked it in my last year of school, like realizing I was in my 3rd year of doing thousands of hours of work. And I was like, but what do the needles actually do? And I have a lot of answers and a lot of theories, a lot of explanations for it. And the right audience will know what I mean. I feel when I say this, we don't really know. But we have ideas about what it does. So do we talk about what it does in general or what it does in a trigger point or motor point?
Well, first of all, what is a trigger point versus a motor point? And then maybe what is it doing?
Okay. Mm-hmm. Like in my general statement of what I believe needles are doing and what makes sense in my little brain, I believe we are all made up of energy. Okay, so I'm talking about energy. We have electric charge in our bodies. And what better thing to channel electric charge than metal? Like it's a conductor, right? I have clients who are engineers, and just when I say that, they're like, oh, that makes sense. And they're probably my hardest and my favorite type of patient because they're like super analytical about that. But I'm like, we can affect you, right? I used to say it's kind of like a switchboard where it's like, we're going to turn this on, turn this off. Like there's a glitch in your system. Your body's supposed to be able to recognize when something's off, when chronic inflammation becomes a thing, when something's growing in your body that shouldn't be growing in your body, when your immune system's attacking something it shouldn't be attacking. There's a glitch. We don't know what that is. You should be able to recognize it. And if we can use these little needles to communicate with your cells, how cool. We just figure out what pattern of disharmony your body is in and then sort of treat those channels that might be in dysfunction. So that's the general answer. That's usually happening on some level with most people who come in. What's cool, and I think this was a gap for my brain in acupuncture and Western medicine, there wasn't a lot of people doing the type of acupuncture I was doing 15 years ago when I started practicing, where I'm going to talk about that side and then I'm going to talk about the local thing. So anytime a tissue is in pain, we say there's stagnation or something not flow. Like if it has sufficient blood flow and sufficient oxygen, it's going to not be painful. And I compare it to like cutting off a circulation like in your finger. Like if you squeeze really hard, eventually this is going to hurt and like not have blood flow. That pretty much makes sense, right? So stimulating a little microcirculation or like little blood vessels to dilate, we do that with the needles. It's like a little micro trauma to stimulate an inflammatory response, which your brain should know how to do and take care of. So that happens locally just with a couple local needles. Motor point and trigger point needling are things you might have heard of too, and that's what I do a lot of, and that's because when the body's in pain, muscles tend to respond by spasming. Like there's danger, tense up, put pain here so this person stops moving this because it's in danger. And muscles are kind of dumb. They just react. They don't think. So sometimes they overreact and protect you too much. There's certain signals to certain muscles that say don't fire, like stop firing, and other ones that are overfiring. So that ends up causing pain. There's a cycle, the spasm spasm cycle. So when you're in pain, you spasm. When there's spasm, there's more pain. And then it's this vicious cycle that we need to just break somehow. So super effective. And I believe this is why a lot of PTs and chiropractors and people in the Western world have adopted it, is because when we put a needle into a motor point, which is where the nerve tells the muscle to fire or not, or where there's the highest level of innervation, the communication, the electricity part, right? The communication to the muscle. If we put a needle in that, then it is like a little reset button for the muscle. And it's like, hey, calm down, right? So you'll feel a little bit of a twitch and then it should calm down, and it feels kind of weirdly good after that, warm and like something's happening. Like someone got to the source of your pain that you couldn't quite pinpoint before. No pun intended. And when you put a needle in that, like I joke that if I only had one needle, I could probably get people relief by doing a motor point, right? And getting that muscle to calm down. Trigger points are a little bit different. That might be areas where I have a knot right here, or like you touch it and it feels painful, or it shoots somewhere else. This is where I think a lot of people need some insight into what's going on in their body, where they're like, it radiates all the way down my arm, or it's going all the way down my leg, but it's all coming from this one place. So we'll identify that. And one common phrase I'm sure all of us hear in our work is like, how did you know that was tender? How did you know where to go? She always knows where to go. And it's just very common patterns. Like, I promise I'm not psychic. It's just like super common patterns. So we'll go and we'll find those trigger points. The reason it's different than a motor point is because it's just concentrations of inflammation or fascial connections that are kind of sticky, right? Like it'll feel sticky to the touch. It'll feel sticky to a person too, to them. And we want to go in there and break it up a little bit, right? This is what you do in massage, but a needle gets under the surface. And I'm like, physically nothing gets in there like a needle does, right? So we can go break up those trigger points and get blood flow going, and you'll feel like an immediate sort of, like it'll not be there afterwards. It'll be soft and feel like healthy tissue again after. So we'll do a combination of getting to the motor points, which are anatomically located in the same place for everybody, and trigger points, which can be a little bit different. But which ones are active, we'll kind of go and attack those a little bit, and it feels pretty good for people.
So when you say that the Western folks are doing some stuff with a needle versus us doing stuff with the needle? Is there a difference?
Yes and no. The difference is who's holding the needle. They're doing acupuncture and we are acupuncturists, right? They're kind of doing one part of what we can do. Just like I can give somebody a stretch that I know is good for their body, but I'm not a physical therapist, right? So that's why the naming gets weird, because they're just not allowed to call it acupuncture, just like I'm not allowed to call it that I'm a physical therapist, right? So the difference often on the receiving side as a patient is someone who has a lot more experience with needles in their hand. We often don't inflict pain with the needle, right? Or discomfort on that level. It should be very temporary. When I was first putting needles in people, it didn't feel as good as it does now, right? Like you have to practice a long time, and thicker needles are easier to get in to the skin, so they don't bend or bow as much. So when you channel that ability, when that's the one thing that you do all day, every single day, it's going to be a little bit smoother of a process. And that's no shade whatsoever. It's just all of us need more practice doing things. I'd rather have a surgeon that's done the surgery that I'm having done thousands of times than someone who might be the best surgeon in the world, but they do a bunch of different things. I'm like, I want the one person that does this one thing. We put needles in people all day, every day. That's a more comfortable process when you have more experience. We can also use thinner needles to achieve the same outcome. So it's kind of like we can do less and accomplish more.
You mentioned breaking the cycle.
Yeah.
How do you break the cycle? Like acupuncture, herbs? What do you do to break a pain cycle?
So I refer to that in the pain spasm pain cycle. So we can either break the cycle by breaking the pain or break the cycle by breaking the spasm. So sometimes I'll approach it by breaking the pain. I'm going to talk about the spasm part first, though. If I approach it by breaking the spasm, that's what we do when we needle trigger points or motor points. Then that person should be in less pain. That should break the cycle, right? So it won't keep feeding itself. Sometimes, this is where I'm going to circle back to like the differences, right? Sometimes needling motor points and trigger points doesn't really work as well as we want it to. That person might just be in more pain, I would say that tissue isn't ready for that aggressive of a treatment. I don't love the word aggressive, but it's just a direct treatment. When people are a little bit depleted, like people that feel really tired or really sore after a deep tissue massage or something like that, or they've had this experience with needling, maybe where they're like, it just made it really sore. Sometimes we'll have to break the pain first. This is a big difference that between someone who practices dry needling and someone like us can identify. There's certain types of pain patterns that do much better with a more gentle approach. And that might involve trigger point and motor point needling, but it will be a more gentle form of it. Mm-hmm. And we have to break the pain before they get out of spasm. If we just put somebody in more pain, they're going to go right back into fight or flight and right back into spasm. So maybe I can't even touch someone's injury right away, or they're even nervous to have it touched. We can get them in less pain before that's even necessary. And that might be with some indirect things. It might be with some herbs or some topicals or supplements or things like that, or infrared light therapy, a lot of things that we have that can get them out of that pain. And then we can start to approach it a little more directly.
And do you do the same needles every time?
Like the same points every time?
Yeah.
I would say like on the same person?
Yeah.
Often. And there's just things that work every time, just about every time, I'd say. And the reason we have to do it more than one time is because your body didn't get that way overnight. It's probably been stuck in this pattern for a long time. Why is that muscle overfiring? Why is that muscle underfiring? That didn't just happen today. There's been years and years, most likely, of movement patterns or, postural patterns or stressors, or where that stress tends to manifest for your body. And so we have to, it's like a deeply, deeply dug trench, right? like it takes a while to etch it out and to create a new pathway for your body. Like we have to create a new pattern. So it needs that signal repeatedly. It's like you don't just work out one day and then expect to be in shape or grow muscle, right? Like you kind of have to repattern your whole nervous system and your body's way of thinking and your body's way of functioning. So that's why we do the same points several times before it sort of takes hold. People should notice results relatively quickly.
That's what I was going to ask you next is like when pain heals, is it better right away and it just keeps getting better and better? Like what does true healing look like in your experience?
I usually draw this little graph for people where I'm like, I'm going to try to like draw it so backwards here. It's like you have pain level on the y-axis and you have time on the x-axis. Mm-hmm. And let's say you start up here and you take a medication and your pain goes down. Right. And then like it kind of slowly creeps back up and then you take it again and then it goes back down and then it just kind of keeps crawling and you always have to go back up to that top level or you always tend to. Right. Not all medications work that way. I'm just giving an example. But when you start to truly heal a tissue, it might look a little bit more like this. But ideally, those little changes kind of get smaller and smaller as time goes on. So people will say, well, I had a bad day yesterday, or like, I don't know why my pain came back. Like, I've been doing this for a little bit. And I'm like, well, your body didn't get this way overnight. But ideally, every single time, if people have pain again, it'll be less intense and it'll last like way shorter, right? So like, wow, I really recovered from that. Like the other thing that we're creating in the body with treatment is resiliency. So we don't want every time you do something that might have triggered your back spasm in the past, we don't want that to happen every single time. Eventually, you're going to be able to handle more because we're making that tissue more resilient over time and remember how to be instead of going back into that protective pattern. So real healing is not linear. It's not like just down, like over time we get better. If you zoom in on that, there's a lot more little changes. And I think that it's helpful to have someone navigate you through those because it is exhausting to try to be a person in pain and think, what did I do? What happened? And there's a lot of like self-analysis and sometimes it just happens, right? Like we don't know, like, oh, I think I did something or what did I eat that made me all inflamed or something like that. I'm not saying that that's not a thing. However, it's like we should be able to just adjust the sort of the sails instead of the wind, right? Like, oh, our body can like go with the flow a little bit more. And I think that it's helpful for people to know that because they're not then going, shoot, I did something to deserve this, right? I think that's a big deal too.
And what about heat and ice? So I know in TCM and Chinese medicine, we always talk about everybody needs heat, but is that true with pain? I mean, don't you need ice?
Oh, that's a good question too. We have a famous saying in Chinese medicine that ice is for dead people. Now, I don't agree with that 100% of the time. I agree with it some of the time. I think that a lot of times we think ice is the way. The person who created the RICE principle, rest, ice, compression, elevation, in the 80s, retracted the statement that that is the best thing for acute injuries in the 90s. And we still didn't update like our common knowledge, right? So ice has its benefits. We love warmth and heat. Tissue wants healthy blood flow to thrive. That's why we're like, needle that area, put a heat lamp on it, right? Like movement is good. Stagnation, like ice makes us contract, right? Like it makes things kind of slow down. Sometimes you want that. The reason you want that is in like the first 24 to 48 hours of an acute injury, right? To kind of help control the swelling and that inflammatory response. And other times, the only other times I encourage ice is when there's certain areas that heat just doesn't get to on a deep enough level. So one example would be like a herniated disc. And even in that case, I only put it directly on the disc area. And then we still want to put heat like on the muscles. And I'll often educate patients, the benefit of ice is actually in the removal of the ice. So put the ice on the injury, all that blood flow goes away or kind of redirects itself and those vessels kind of constrict. When you take it off, more blood flow can come to the area. Fresh, ideally, what you're doing is getting that fresh blood flow to the area. This is where cryotherapy and cold plunging, this is the popularity of it, because all that blood flow goes to your core, gets freshly oxygenated and good and full of nutrients, and then comes back out to your limbs. So it's supposed to help with recovery. And I do believe there are certain constitutions that do really well with that. I want to say this to different strokes for different folks, right? Like what we really excel at in Chinese medicine is helping someone understand their own constitution. Like they'll say, I was reading this thing and I think I should start cold plunging. But we can say like, actually, you're someone who might benefit from that. And we have certain people where we're like, I wouldn't recommend that for you. Or I wouldn't recommend that at certain times for you. Here's how you can incorporate that, what times you should do it. You know, maybe during a woman's cycle, there's certain times they should avoid. Some people are overdoing it with the hot yoga, and we have to say, you know, dial it down. Or someone might really benefit from heated workouts, and we might say, go there. So it's an age-old debate, and I've changed my mind on some things with newer research. But a lot of times we're telling people heating an injury is a good idea because we want to get blood flow going to it, and also listen to your body. A lot of people will say, I don't know if the ice is doing anything. And I would say in that case, they're probably correct. So
2 more questions.
Sure.
Does acupuncture hurt?
You might experience a little discomfort, right? There's a difference between discomfort and pain. And it should not cause pain that makes you go, take your breath away. It's not injury type pain. It should be productive type pain, like when you get a good stretch, right? Or you might feel like a tiny little prick and that's it, and that goes away. That should go away quickly. Whenever I do trigger point and motor point needling, it sounds a little scary because I'm like, I want your muscle to twitch here. That doesn't usually feel painful. It just feels kind of odd. And sometimes when maybe someone's had needling done by someone else, that was a painful experience. We have a really good gauge on the response of the body and what that's supposed to be. And so you will not be laying there in pain. You shouldn't feel anything sharp, pinchy, or otherwise uncomfortable when you're resting. Most people take a nap for I think most of my patients nap for 30 to 40 minutes. And so I think that was the wildest thing to wrap my head around when I first started getting acupuncture was how do you sleep with all those needles in? You don't even really feel them, and you shouldn't once they're in. The discomfort is extremely temporary. I think that's an important part to know. And some people don't feel that at all. When someone's a little bit more, we'll say the word sensitive, but I think they're just very responsive. If their chi is very accessible, on the surface, then that person we might take a more gentle approach with. We have a way of really tailoring the treatment to a person's body. We're not there to elicit a pain response. Right?
Great. And I'll end with this. If there's one thing that people could start doing today to help with their health, what would that be? Or what's one thing that is a non-negotiable for you?
The funniest thing is the first thing that came to mind is eat breakfast. I know Chandon loves that answer. I would say be sure you are moving your body in a way that works for your body. And that's a very general answer. People aren't going to know exactly what to do with, I'm sure. But I think that's where we can come in and help them. So, yeah.
Awesome. Thank you.
Oh, great.
Well, if you would like to work with Liz Mierendorf, you can find us online at www.Isthmus Wellness, that's ISTHMUS wellness.com, or you can give us a call, 608-441-9355, and book an initial acupuncture with her.